Hello, I am Dr. Pranav Dave, Professor and Head of the Department of Community Medicine, right now working at BARDA Homeopathic Medical College in Gujarat, practicing homeopathy since last 30 years. Yesterday, as in first episode, I will talk about that so many results I have observed, analyzed and experienced by using the homeopathic medicine effectively in so many clinical conditions. Acute as well as chronic conditions are also covered if it is indicated in a right way according to the law of similia. I am here to share practical as well as clinical knowledge of indications of rarest of rare homeopathic medicine to students as well as to the new practitioner. In a part of that, once again I am requesting you to kindly follow, subscribe and press bell icon so that you can get the immediate notice as soon as I publish the new episode. Today I am going to discuss one of the important polycrest remedy which is indicated in acute as well as chronic condition. The name of homeopathic medicine is Aranea Diadema. It is a medicine prepared from papal cross spider, Arachnida family. The medicine has a hydrogenoid constitution. It is a deep acting polycrest remedy. It is a master remedy for hydrogenoid constitution where patient is very sensitive to cold, dampness and periodicity. It is another characteristics of the medicine is periodicity. The another medicine is a sadron. So part 2 preparation and its origin. The distinctive cross mark on the abdomen of the spider gives the name papal cross spider. The medicine is prepared from the garden spider. It belongs to the Arachnida family. The spider is triturated to make the remedy. The preparation as per as the pharmaceutical subject has concerned, the triturations is prepared from the whole spider in a homeopathic pharmacy and it is available from 6C to 1M potency. Generally lower potencies are more suited to acute condition and higher potencies are suited or applied to the chronic cases. It belongs to animal kingdom. Like other animal remedies, it acts deeply on nervous system. It has got affection to nervous system. It is producing extreme sensitivity and strong survival instinct is much observed when we plan to apply the Aranea Diadema to the most simillimum cases. The core concept of the medicine is a hydrogenoid constitution. The patient is having a highest sensitivity to damp, cold and towards moisture. Patient unable to live near fresh water, lakes, rivers or in damp or in marshy areas. Patient doesn't prefer to stay at chilly places, even though patient doesn't prefer to stay in basement as well as in the place where the वाटर सोर्स इज नियर. हिंदी में अगर कहा जाए तो असामान्य नमी और ठंड के प्रति अत्यंत संवेदनशीलता के कारण पेशेंट तालाब, नदी या नमी वाले स्थानों के पास रहने में असमर्थ रखता है. कैन नॉट लाइव नियर वाटर. अनदर मेडिसिन कैन बी द सैड्रॉन. Symptoms return at the same time daily, weekly or seasonally. I can give the example that colic, fever, bone pain all come back at a predictable and specific time. This is the hallmark that confirm the Aranea indication than other remedies. But here you should also differentiate with this sadron. Patient is worse in damp weather. So many other medicines are also indicated for the same. Even entering in a basement or cold room triggers the chilliness that penetrates to the very bones. No blanket can relieve it. Patient try to moving away from such places and that gives instant relief. That is the clinical and distinguishing features of Aranea Diadema to indicate. So look for the key identifying features. Patient has got a specific cold and damp aggravation. Patient has got a deep bone pain, severe pain in the long bones. Generally, long bone affections are more seen in indication of Aranea Diadema, where particularly in the legs, arms, os calcis or plantar fasciitis is also indicated. Generally, we used to use frequent in a low potencies to treat the plantar fasciitis, in which patient is always complaining about the pain in the heel, which is aggravated during the motion. Pain is deep, boring and feels like the bones are being pressed from the inside. It is the indicated symptoms of the plantar fasciitis as well as indicated symptoms of the Aranea Diadema. Another feeling of the patient is patient has got a feeling of expansion of the body, especially at the night. Patient wakes up from sleep with the sensation that hands or forearms are swollen twice their normal size. On checking, there is no actual swelling. It is only a sensation. That is a sensation of expansion that has been already felt by the patient. Patient generally wakes up from the sleep and he check himself or herself that whether it is true or not, but it found nothing. It is an inner cold that patient is experiencing. Another pathological or pathophysiological indications of the Aranea Diadema is the spleen enlargement. Enlarged spleen is a strong indication, especially when linked to malaria-like symptoms. Patient may have periodic fever with coldness, bone pain, resembling to malarial poisoning. So many other medicines are to be differentiated over here. I had just explained the key features of the Aranea Diadema. Another symptoms pertaining to mental and nervous part is a animal remedy, hence hypersensitivity of nervous system is more seen. Periodic restlessness is also observed and delusions of enlargement. Patient has got feeling of expansion. हिंदी में अगर कहा जाए तो तंत्रिका तंत्र की अति संवेदनशीलता, बेचैनी और अपने अंगों के बड़े होने का भ्रम, it is called a delusion. It is also indicated wherever there is a restlessness and anxiety apprehensions towards the health. Patient gets up at night, he check himself or herself, there is anxiety without a clear cause. Waking them from the sleep, the anxiety is closely tied to their physical symptoms. But there is no such evidences are observed. Patient feeling of hands and brains got expanded, it becomes doubled in size. This is a very particular and confirmatory symptoms unique to Aranea. No objective swelling or expansion or such enlargement is observed on examination. Hypersensitivity, as it is an animal medicine, hypersensitivity is always obvious. External sensitive to all stimuli, sound, light, cold air. Another medicine can be from your plant part is a Naxwamika. Being an animal remedy, the nervous system is on high alert at all times. Minor changes in weather affecting mood and energy drastically of the Aranea Diadema patient. Periodic mental dullness, mental slowness or foggy thinking returns at specific times. Usually in the evening, when the physical symptoms improve, the mental clarity also improves simultaneously. It is an indicated understanding symptoms of the Aranea Diadema. Physical symptoms as per our body system: head heavy sensation, deep boring pain in long bones of arms and legs, pain in os calcis, chest breathing worse in damp weather, abdomen and sleep, enlarged spleen or splenomegaly is a key feature. Colicky pain returns at the same hour every day, heaviness in lower abdomen as if a stone is placed there. Diarrhea may occur periodically. Patient has got an expansion feeling of abdomen and he has got enlarged spleen. It is also aggravated in the rainy season. Another medicines are also there, but it is a subject of comparison. Fever, coldness with pain in long bone and stone-like feeling in the abdomen, all occurring at the same hour daily. Chilly day and night, always worse during rain and damp weather. Patient always wants himself or herself to be covered. Restless sleep with frequent waking. Wakes feeling as if hands and forearms are greatly swollen and heavy. He feels that it is expanded. Unable to sleep on damp nights. He cannot sleep and stay in the basement also. Better after rising and moving around. Patient has got a very peculiar and particular modalities which makes the patient worse or better. Patient is worse in any cloudy, rainy or humid day, dramatically increases all complaint. The patient dreads the monsoon season. Whoever is reluctant towards the rainy season or stay in the rainy areas, it shows that there is a affinity towards the animal kingdom, that is Aranea Diadema. Late afternoon and midnight aggravation. Evening aggravation is very consistent and predictable. Cold air, cold places, entering in a cold room, basement or air conditioned space immediately worsen the chilliness and pain. Here you can compare with the Sticta pulmonaris too. Periodically, all symptoms return with great regularity, same time daily or seasonally. Here you can also compare with the Sadron. Patient has got a very specific particular amelioration, that is a smoking tobacco. One of the most peculiar amelioration in homeopathy. Symptoms genuinely improve with tobacco smoke. This is a strong confirmatory symptoms. Two symptoms are there. One is the feeling of expansion but found nothing, and another feeling of better when he smoke with the tobacco. Another amelioration is a warm dry weather. Dry warm sunny days provides remarkable relief. Patient better in summer season. Symptoms always disappear when weather is clear and warm. That means patient is better in a summer season. Higher altitude or dry places. Moving away from coastal or low-lying damp areas to dry elevated places brings significant improvement. And moving about, gentle movement and walking around helps reduce the restlessness and heavy bone pain. Here you can compare so many other medicines. One of the most prominent medicine is Rustox and Gelsemium. Clinical condition: malaria and intermittent fever, neuralgia, bone pain, os calcis, that means plantar fasciitis, splenomegaly, with there is a pathophysiology must be indicated, humidity related to disorders, asthma, rheumatism, arthritis, or any condition that consistently worsen in damp weather and near water. Aranea should always be considered in such cases. Aranea Diadema has a very particular key differences with so many medicines, but I have selected 4 medicine. One is a Natrum sulph, another is Thuja, third is Dulcamara, and fourth is a China officinalis. Aranea Diadema, cold to bones, exact periodicity, worse near water, heavy hands at night. It is a indicated symptoms or key differentiating point of the Aranea Diadema to other medicines. Another is a Natrum sulph, which is also worse in damp weather but more liver oriented medicine. Asthma and suicidal depressions is also observed in the case of Natrum sulph, while Thuja has got a hydrogenoid but mainly warts, gonorrheal miasms, left sided complaints, and particular and peculiar mental symptoms are also marked as the limbs are made of woods. Dulcamara is another medicine which has got same tendency. It is an indication of the Dulcamara. And China officinalis is also has a periodic fever with the sweating, debility, spleen, but no bone coldness. These are all the comparison with the similar medicine. Here I have not talked about cedron, arsenic iode also, but they can be also considered and compared. Now it is a question for prescribing guide in accordance to dose, repetition and case tips. Earlier I told that it is a medicine indicated for the acute as well as chronic condition, even though you can also indicate as an intermittent medicine. Whenever you want to plan to prescribe, you must observe that patient must have a hydrogenoid constitution. That means all the complaints must be aggravated by the water by staying at the basement. It must be aggravated in cold monsoon weather, cloudy weather. It must have a strict periodicity of the symptoms. That means first possibility is to hydrogenoid constitution, strict periodicity like cedron, bone deep coldness not relieved by the warmth, sensation of enlarged hands or sensation of expansion feeling at night, found nothing. Another, in acute condition like malarial fever or bone pain, new practitioner can start frequent doses of 30C and infrequent doses of 200C. Give a single dose and wait for response. If improvement starts, do not repeat till the effect wears off. Dosage in clinic for chronic cases with the deep-seated bone pain, splenomegaly or long-lasting hydrogenoid tendency, start with 200C, but it is not my advice to repeat the medicine. With that, you should also advise the patient or to make a change in the lifestyle as well as in the diet pattern. Advise the patient move to a dry, elevated place if possible. Patient has to stay away from the basement and contact with the cold. Patient has to consume warm food, warm water, warm clothing, staying dry, and all support recovery along the remedy. Once the correct potency is given, patient often notice less sensitivity to cold or damp within a 2 or 3 weeks, reduction in bone pain, better sleep, reduction in spleen size over months, good prognosis with correct selection. Aranea Diadema, the spider that conquers cold, damp and periodic pain. It is a medicine from hydrogenoid constitution, extreme sensitivity to moisture and cold. It has got exact periodicity. जो रोगी ठंड और नमी में बीमार पड़े, जिसका दर्द हर दिन एक ही समय पर आए, सोचो ये एरेनिया डायडेमा तो नहीं है. Thank you very much once again to new practitioner, to my students, whoever are listening me, whoever are following me. Please like this video. Please subscribe. Thank you very much.